right, today we're going to talk about the cardiac conduction system. So how's electrical activity carried through the heart? Well, why do we need electrical activity through the heart? Because when that happens, it stimulates the myocardium, or the muscle cells of the heart, to contract. And that's what squeezes the blood and pumps the blood out of the heart. So it's important for the heart to contract, which happens during depolarization, and then to relax, which happens during repolarization. So the intrinsic innervation. So what the actual internal innervation of the heart is, we have this kind of like skeletoned out here. So we have the SA node, which is called the pacemaker, that'll spontaneously depolarize. We'll talk about that. It carries the depolarization into the left atrium through Bachmann's bundle. You don't need to know the name Bachmann's bundle. So the SA node's located in the right atrium. It's carrying it over to the left atrium via Bachmann's bundle. There's these connections between the SA node and the AV node. So SA node is the sinoatrial node, right? So it's in the atrium and produces a sinus rhythm, a steady beat of about 100 beats a minute or something like that, right? And the AV node, the atrioventricular node, it's between the atria and the ventricles, right dead in the middle of the heart. And then there's going to be a delay there of 0.12 to 0.2 seconds. That allows the atria to fully contract and push their blood into the ventricles and have the mitral valve and tricuspid valves close, right? The atrioventricular valves close before the ventricles contract. So the SA node keeps the pace. It's like the pacemaker. And the AV node allows that delay for the atria to contract, push their blood into the ventricles, get that atrial kick, right? Which is going to be important for cardiac output. And then the valves close, right? The tricuspid mitral valve close, then the ventricles can contract. So it creates a little bit of a delay. It's 0.12 to 0.2 seconds, or you could say 120 to 200 milliseconds is normal. And you can see that on an ECG. There's the bundle of His, which then splits into an RBB and LBB. I didn't write them out. RBB is right bundle branch. LBB is left bundle branch. And they'll go through the interventricular septa, and they're basically carrying it to the right and left sides of the ventricles. And then those are carried along the walls of the ventricles through these things called Purkinje fibers on each side. That's the intrinsic innervation. That's the pathway through the heart. You do need to know that. You don't need to know Bachmann's bundle. Okay. The important concepts are the SA node is spontaneously depolarizing, and you know the atrioventricular node creates this delay, which allows the atria to fully contract, then the ventricles contract, right? Because they don't contract all at the same time. If you had a problem like atrial fibrillation, your atria are just doing this, and they're not contracting properly, you lose that atrial kick. We'll talk about that. We talked about that in the cardiac cycle, and you'll lose some cardiac output. So this is what's happening in the nodal cells specifically as in regards to ions. So there's a leaky sodium channel. So the resting potential is negative 60 millivolts. Now, as soon as we hit the resting potential, these sodium channels are kind of leaky. They're kind of like always like kind of flapping open a little bit, and sodium's just leaking in right away. So sodium immediately starts leaking in. If positive charges are moving in, we're moving away from negative 60 millivolts, and we're getting less negative. Now, the threshold here is about negative 40 millivolts, so we'll just leak in until we hit that, and then all these other sodium channels open, right? Just like in nerves, and they depolarize, all the sodium rushes in. We depolarize, so this is depolarization, because we're going from being polarized to zero, right past zero. And then the sodium channels close, potassium channels open, potassium leaves, potassium moves out, and that repolarizes the nodal cells. But guess what? As soon as we repolarize, it starts leaking in right away. And that's how it works in those cells. That's how it spontaneously depolarizes. Now, this will carry the electrical charge through the myocardium. So those are nodal cells. So the myocytes, so these right here representing, let's say these are the nuclei. Some poorly drawn nuclei here. So let's say these are the cardiac myocytes. So cardiac myocytes, they're similar to skeletal muscle cells, but they're uninucleate. They're not multinucleated. And they've got a couple features here. So these are myocytes, or cardiac myocytes. So the myocytes and the nodal cells are a little bit different. A couple features here you should understand is, these things do branch. They branch between cells. That helps create that functional syncytium by connecting the cells really well. And these purple things here, these are gap junctions. So gap junctions actually allow the movement of ions between the myocytes. You can see how that would really help when one cell depolarizes, the next cell depolarizes, will just kind of this huge domino effect and work in a really good manner. That's why I get this really called a functional syncytium, because all these cells functionally work as one thing. That's what that fancy word means. So a syncytium. So they're separate cells, but functionally they're working as one unit, and that's what how you want your heart to work. Okay, so let's this is what happens in the nodal cells here. So what happens in the myocytes, as far as ions go, we can look at that. We'll look at one just cycle here. So it's a little bit different. There's more phases to it. You don't need to know all the phases, but so the myocytes, not the nodal cells, they actually have a resting potential about -90. Okay, and what happens to them? They're like that. They have this flat phase, so there's not anything leaking in. They need to get stimulated, right? And once they get stimulated, well, then they'll depolarize. And they depolarize up like this, goes up high. You kind of have this peak, and then it falls to like a plateau phase, and then it comes down. All right, and then it comes down. So we call this first phase. This is phase 4. Depolarization is phase 0. This is phase 1, phase 2, and phase 3, where in the nodal cells, you don't have a phase 1 or phase 2. You have phase 4, phase 0, phase 3. So you have that the resting area where there it's leaking in a little bit, depolarization, repolarization. You don't have this. This is we call it our plateau phase. So what's going on here? So you got to excite these cells. Once you excite them, well, they're good to go and they'll depolarize. So in phase 0, sodium channels are opening and sodium is moving in, right? So sodium in. Then we hit this high point here. We start phase 1. Well, here the sodium channels close. So right here, so Na, so sodium channels close. But something else happens, potassium channels open. So right there at this point, then potassium channels open. So K+. So K+ channels open. So positive charges stop moving in, positive charges start moving out. So we start to repolarize a little bit. But what happens here in phase 2, we have calcium channels open. So in phase 2, now calcium channels open. Okay, so calcium channels open. And we know there's more extracellular than intracellular calcium, just like with sodium, so calcium moves in. So in this plateau phase, what's happening here is calcium is moving in. All right, so potassium's moving out. Calcium's moving in. So they're balancing each other out here. And then at this point right here, then the calcium channels close. When calcium channels close, potassium continues to move out. So phase 3, we're just seeing potassium out, right, until we fully repolarize, okay, and go back to normal. Okay, so that's the point. So at this point, sodium channels close, potassium opens, potassium starts moving out, but then calcium channels open, calcium starts moving in while potassium is moving out, and that creates the heart to squeeze and kind of stay squeezed, stay contracted for a second, kind of, because it's staying depolarized. There's a little bit of a delay there. Okay, so to make this less messy, if you want to just make it more simple, look at it like this. Get all this out of the way. And you can say this. So phase 0, so phase 4, resting, right? Phase 0, sodium in. Phase 1, potassium starts moving out. Then calcium starts moving in phase 2. This is your plateau phase. And then potassium continues to move out this whole time. You see this? Just calcium moves in for a little bit, then stops. So you have calcium and sodium channels and potassium channels going to work here. So that's what happens in the myocytes, and that's just going to carry the conduction through the heart. The next video, we'll talk about extrinsic innervation.